Good evening, dear viewers, and welcome to a new episode of Medical Talk. Today's topic is a digestive condition that is often misunderstood and frequently misdiagnosed. Small intestinal bacterial overgrowth, commonly known as SIBO. It occurs when excessive bacterial growth in the small intestines, leading to digestive discomfort and symptoms that can significantly affect quality of life. Many patients live with bloating, abdominal pain, diarrhea, maybe constipation, or unexplained fatigue without realizing that SIBO may be the underlying cause. To help us better understand this condition, its causes, and modern treatment approaches, we are honored to welcome Dr. Wafaa Alhashash, a consultant in internal medicine, gastroenterology, and hepatology. Stay with us. You're watching Medical Talk. Welcome back to the program. We are happy to have with us Dr. Wafaa Alhashash, a consultant internal medicine, gastroenterology, and hepatology. Dr. Wafaa Alhashash, welcome to Medical Talk.
Thank you for having me here in your program, and it's really nice to be with you.
Thank you so much. I have so many questions for you, okay? And our topic today is very, very interesting, at least for me, because it's one of those conditions that is kind of confused with other conditions, but it's very common, and I think it's worth that we shed the light on it today. But before we go into more details, could you explain to our viewers, because I was explaining earlier in the introduction about this condition, what is SIBO and how does it differ from normal gut bacteria balance issues?
I think you're choosing really a very important subject because so many people they don't know about it that much. SIBO, it stands for small intestinal bacterial overgrowth, or in abbreviation it's SIBO, or in Arabic فرط نمو البكتيريا في الأمعاء الدقيقة. So what's SIBO? SIBO, it's a bacteria that's usually in the colon or in the large intestine, but it has its way to move into the small bowel, and then it will grow. The small intestine in the let's say in a regular person, let's say in 70 weight kilo for that person, it's around 6 meter.
Yes.
This 6 meters, the food will mix with the digestive enzyme, and whatever it's important to us, it's going to go into the liver and to the body. And whatever it's waste and we don't need it, it's going to go to the colon.
The large intestines, basically.
The large intestines, the colon.
Yeah.
تمام. طيب. Usually the small intestine, they don't have bacteria. طيب. Once they have bacteria in the small intestine, so the bacteria, instead of eating the waste material or whatever it's left from the food, it's eating the food itself. So it will ferment the food, and then it will produce gases, and it will inhibit the absorption, and it will use the food that you're eating, especially the vitamins and minerals, whatever. So it will not go into the system, into the body, other than going into the colon, or it's going to be eaten by the bacteria itself. So what we call it, that's the bacteria inside the small intestine. Whenever the concentration of the bacteria in the small intestine increases, that's usually there's no bacteria in it, tamam, then we call it SIBO.
Okay, so what are the most common symptoms that's associated with SIBO?
All the GI symptoms, like for example, after eating, the patient will start to have bloating, gases, increased bowel sounds, sometimes this abdominal discomfort, and sometimes this pain, nausea, sometimes vomiting, also altered bowel movements between, diarrhea and constipation. Also, it won't be only the GI symptoms, but also it will have effect on other things. Let's say that the patient will have some sort of psychiatric symptoms, like for example, foggy brain. They cannot concentrate. They have insomnia. They cannot even have the ability to sleep. Anxiety, panic attack. It can be associated with SIBO. It's not only this, because as I said, the SIBO, it means that the minerals and vitamins, it won't go into the body, so the patient will suffer from the deficiencies or less vitamins and minerals inside the body. So the person is going to be starting, like for example, having anemia, low iron, the hair, it will fall down, the skin texture, it's going to be different, even the general weakness. They feel that as if they're more than their age by 10 or 15 years above. So it's multi-symptoms. But the most important regarding SIBO, that the people, they won't understand like how common is it, because as you said, it's really resemble and it's similar to other causes and other diseases inside the GI system, like for example, H. pylori, lactose intolerance or enzyme deficiencies, food allergies, Crohn's disease, ulcerative colitis, irritable bowel syndrome, which is the most common, and the most important, like the discomfort in the GI system after sleeve gastrectomy or the bypass. So these kind of variety of symptoms, they need really a good gastroenterology to find out what's going on in that person. For example, if you're saying like, it resembles that IBS or irritable bowel syndrome, according to the studies, it's around 80% from people who suffer from irritable bowel syndrome, they do have SIBO. Like so many people, they come to my office or to my clinic, and they have the IBS symptoms for years, and they are not improving. Once they do the test for the SIBO and it's positive, and so only the treatment only for 2 weeks only, they can notice dramatic changes. Let's say that that person, for example, he did sleeve gastrectomy or bypass surgery. 70% of them, they have SIBO type. What about like the Crohn's disease and ulcerative colitis? It's around 50%. Diabetes, 60%. Hypothyroid, it's around 30%. Fatty liver, it's around 40%. So it's really common, and it can coexist with other causes. Like for example, let's say that person, they do have SIBO. Okay, they receive the treatment of the SIBO. We are right now much better. But after, let's say, a month or two, the symptoms will recur. Why? Because the predisposing or the cause of SIBO, we didn't look into it. So we have to treat the SIBO, and in the same time, we have to look into what's causing SIBO, plus what's the complication of SIBO. So as if that you are in a circle, okay, where the SIBO is in the middle, and something is causing the SIBO, and the SIBO, it will cause other stuff. So we have to put our eyes on the problem and whatever it's causing the problem and the complication.
I'm glad that you mentioned that, but before, I'm going to ask you about the risk factors that or causes that could lead to bacterial overgrowth. But before that, can you clarify, are we talking about good bacteria or bad bacteria?
Bad bacteria.
So it's the bad bacteria. So it's not the good bacteria, normal flora gut that we have.
The small intestine shouldn't be having bacteria. All the bacteria, it's in the colon or in the large intestine, but not in the small intestine.
Okay, so if you have the bacteria in the small intestines, that's mean this is definitely a bad bacteria.
Absolutely.
Okay, so now I'm going to go back to the main causes and risk factors. You kind of like touched on some other underlying conditions that could lead to that. But could you elaborate more on that, about what are the main causes and risk factors for SIBO?
As I said, like first thing, like we have to have normal motility of the gastrointestinal system. Whenever we have a problem with the motility, then we're going to be having SIBO, because the food will stay longer time in the small intestine. Plus, in case that the patient having a problem with the acidity inside the stomach, So if we're decreasing the acidity for a long time, that it will predispose into the bacteria into the small intestine. Plus, the integrity between the small intestine, large intestine, the ileocecal valve, whenever it's working fine, there's no problem. But let's say it's leaky, so the bacteria will move from the colon into the small intestine. But there is predisposing factors, like for example, the person who's taking proton pump inhibitor for a long time, for any reason whatsoever. Plus the old age. The old age, they have multi-drug. Plus, they have decrease in the acidity in the stomach, so that's a predisposing factor. The diabetes, so whether it's type 1 or type 2, the diabetes will impair the motility for the small intestine and the large intestine and the GI system in general. So that's a predisposing factor, especially like, for example, the hypothyroid. It will also impair the motility for the small intestine. Whenever we have the permeability for the GI system, like for example for Crohn's and ulcerative colitis, yes. The food allergy, it's also celiac disease, which is the allergy to gluten. Also, it will predispose into the SIBO. So many things.
So it's a multifactorial.
Multifactorials.
We have more to talk about, but we have to take a short break and we'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Wafaa Alhashash. Dr. Wafaa, before the break, we were talking about SIBO, which is the small intestine bacterial overgrowth, and how it could be easily overlooked by other conditions. It could mimic other conditions. So it's important for the patients to see the proper physician who is specialized in this condition, with the GI basically conditions, to kind of distinguish whether they have SIBO or not. Surprisingly, as you mentioned before the break, that there is a huge percentage of patients who, for example, who have other conditions, they actually can also have SIBO, and SIBO could also lead to other conditions.
Absolutely.
I want to jump into the most common ways to diagnose it. Like, walk me through a day in your life in the clinic. For example, a patient wants to come and wants to confirm or diagnose. How do we diagnose SIBO?
Like any other specialty, we will start with ABC, which is the history examination, and then the investigation. If we're talking about the investigation, for example, for the blood test, we need to look into if the patient's having vitamins deficiencies. For example, as I said, the patient can have iron deficiency, they can have low calcium, they are more prone to have osteoporosis because of the absorption, less zinc or magnesium. So all that with all complication of deficiencies of vitamins and minerals. Plus, the gold standard for the diagnosis of SIBO, it's the breathing test. There is hydrogen and methane, or only hydrogen breath test. It's very easy. It's non-invasive. There is no pain. There is no sedation. Nothing. It's just a breathing test. Except that there is certain precaution for that breathing test to be done in the right way. It's especially, like, for example, like there is some sort of medication that needs to avoid before 1 week, and there is certain food before 1 day, and fasting for 12 hours except for water. And then it's a small device that they can breathe every 20 minutes. After the first breath, which is the baseline, we can give like a small reagent, like they can drink it. It's kind of sweetie, tamam. And then every 20 minutes they can breathe into that machine. After 2 hours, we can have the result, whether it's positive or negative. So, but the patients should have follow the instruction very carefully, and it's not painful. Like it's just a breathing test.
So it's just an easy test they can do.
It's an easy test.
Okay. So what are the treatment options available now for SIBO?
Any problem or any disease for gastro, you shouldn't be only rely on medication by itself. It should be medication and dietitian plus the change in the lifestyle. So number one is the medication. There is a variety of antibiotic, but the most important is the rifaximin, which is actually it's for the SIBO, but there are other antibiotic also can be given for the SIBO, but it's also for 14 days, and that's only the treatment. during that time and after, the patient needs to see the dietitian, because there is certain food they need to avoid during the time of treatment, plus till the patient will have the reason why he do have SIBO. تمام. So the problem won't reoccur again. Plus the changes in lifestyle, like for example avoiding caffeine, to encourage exercise, to get enough sleep, enough water, all these stuff for the regular healthy lifestyle, let's say. But the cornerstone is the antibiotic plus the dietitian.
Okay, is there a chance of recurrency for this, for SIBO? And if so, how can a patient try to reduce the risk of relapse?
As I said, he needs to know why the SIBO exists
in the first place.
So what's the reason? Is it the problem that he's having, like for example Crohn's or ulcerative colitis, or food allergy, or like let's say lactose intolerance or celiac or H. pylori? There's so many things inside the GI system, plus outside, which is diabetes, hypothyroid, others. Plus, in the same time, we need to fix the complication, which is the deficiencies in vitamins. We need to replace it and to check it every now and then to avoid also the deficiency in long term. Plus, we need to know what's the percentage of improvement. If not that much improved after the medication, means that there is some sort of things that's going on with the patient as a result of SIBO, like for example SIFO or leaky gut. So we need to know what's going on. SIFO, it's a small intestinal fungal overgrowth, which is because the patient is taking antibiotic after antibiotic. So trying by himself without consulting the doctor. So the bacteria, it's there, but less concentration. But it's right now, it's the fungal comes into the place, which is worse.
Yes, exactly.
And the leaky gut is basically, as I said, the small bowel, like there's a small opening. Through this small opening, the good food and food particles is gonna go into the system, and whatever it's waste is going to go into the colon. So let's say that the patient is going to have SIBO for a long time. So this opening is getting wider. So once this opening is getting wider, the protein and large particles, it will go into the blood. So the blood, it will recognize this as if it's foreign material. So right now, the patient is going to be having the immune system is going to attack these particles, and then the patient is going to have immune response and symptoms regarding the immune system. For example, eczema, urticaria, psoriasis, name it.
It all is going to reflect on the other organs, basically. Now, you mentioned diet in your words. How important is diet in terms of managing SIBO?
As I said, it's a medication, and diet, it's the cornerstone for the treatment. You cannot do only the medication, and you cannot follow only the diet. It should be two together in the same time.
But what kind of diet advice would you recommend for your patients?
I would refer the patient to dietitian, but actually there is certain food they need to avoid, like for example honey, because the bacteria is going to be really happy to take the honey and the sugar, the lactose products, gluten. That's also in certain people they need to avoid for certain time, not all the time. Or they can follow the food map. So through the dietitians that they can write for them what they should eat and what they should avoid.
Okay. What complications can occur if SIBO left untreated for a long period of time?
His life is going to be really miserable. As I said, it's not only the GI symptoms like bloating and abdominal pain or foggy brain and loss of concentration and the skin and the hair and whatever, the general weakness and others, plus the deficiencies of the vitamins. But also the person will have also the complications. As I said, it's the leaky gut, the SIFO, and name it.
Exactly. Now, I understand that these things are very important. If you have one final message to give to our viewers, what would it be?
Whenever you have any symptoms for gastro, for example, bloating, abdominal pain, don't hesitate to consult your doctor to find out what's going on, especially if the symptoms that will occur twice a week for 2 weeks in a row means that there is a problem that you need to find out what's going on.
All right. Dr. Wafaa Alhashash, thank you so much for having the time, giving us your valuable time and giving us all the valuable information that you share with us, and hopefully be able to host you again in the future. Thank you so much.
Thank you, and thank you for inviting me to your medical talk.
Thank you so much. Dear viewers, we still have more. Stay with us. We'll be right back. As we conclude today's episode, we remind our viewers that digestive health is a cornerstone of overall well-being. Persistent symptoms should never be ignored. Early diagnosis and proper treatment can restore comfort and quality of life. Thank you for watching Medical Talk. Until I see you again, please stay safe and stay healthy.